Hiya, welcome to the HIGHERWAY podcast, and today's guest, if I can call her a guest, is Midge Holdsworth. She's one of my students and also a student of one of my students, if you can work that out, Tor. She trains in Muay Thai, but she's also a nurse, working in a fairly challenging environment, which we'll have a little chat about later on. So, hiya Midge, how you doing?
You're all right, Bob, I'm okay, thanks.
Good. So that was my cheesy DJ voice. So I've asked you to do the podcast because I think it'd be interesting to talk to you, because it's not just going to be about the martial arts. It's going to be a mixture of things, isn't it?
Yeah.
Obviously, quite a few people who come on here are martial artists. Not all of them. And I ask them the same question. Why did you start the martial arts?
I think initially, sort of when I was younger, so my brother had some trouble at school and my dad decided to take him boxing. Right. And I didn't want my brother to do anything I wasn't doing. So I went with him.
He's your younger brother, yeah?
Yeah, he is. So he's about 2 years younger than me.
Right.
So I went along to boxing club at the Austin Rover.
Oh, yeah, in Birmingham, yeah.
Yeah. And at the time, I think I was probably about 11, 12. I was the only girl there, and I wasn't allowed to spar.
So you were allowed to train, but you couldn't spar?
Yeah, so I quickly got bored.
Yeah, I bet. Did you want to spar then?
Yeah. You know, I mean, yeah, it was something I was quite interested in.
Yeah.
So I left my brother to do that, and sort of, as 12-year-old girls do, you just get on with going out with your friends, doing your thing. And then over the years, I did a little bit of kickboxing on and off with my friend who she's run some classes as well as she got older. But it never really fit, to be honest. I never really felt like it was my thing.
Right.
So me, my brother and my sister climbed Snowdon in a couple of years ago.
Yeah.
And I was saying to him, I'd really love to do Thai, or, you know, I was looking at boxing gyms again, and I'd been in touch with a few. But I was a little bit not very confident, and I wanted a ladies class. And there wasn't anywhere that really were offering them, that were like, oh no, it's all mixed, you just come down and, you know, whatever. And then my brother said to me, they're starting a ladies class at Thai. And I'd been, like, my son had come to Thai when he was about 5, when you were at the church.
Yeah.
Longbridge,
yeah.
And I thought, that looks really good. And obviously I'd watched my brother do it, because my brother had been doing Thai then for a little while, I think. So my son did it for a little bit, but didn't really get that interested in it. So when my brother said there was the ladies class, me and my sister came along to Tor's class. I just really enjoyed it. It was a small class. It was, you know, but it was good. It just, I don't know, it just felt like I want to say my thing. That sounds a bit odd.
No. The thing is, just so I can explain to people, Tor is one of my students who's like a senior instructor. She's been training me, it's got to be about 7, maybe even 8 years now. I don't know. I've known her a long time. And she came from kickboxing. And she's small in stature, like yourself, but she's hard as nails.
Yeah.
And that doesn't come across when you first meet her. But she's very self-assured, isn't she?
Yeah.
And you did a session with a few girls in the class. I remember you guys training. And then obviously for different reasons, Tor going back to school, obviously she's a teacher. She had less time, didn't she?
Yeah.
And then, of course, we had the lockdown and all of that. But
well, before the lockdown, I'd started coming then to the mixed classes.
That's right.
Because Laura had sort of said she wanted the ladies' classes to be a stepping stone, sort of, to the main classes.
Uh-huh.
And I was quite like I said, I was still quite nervous. I was like, oh, there's going to be loads of people that are really good. They're not going to, I'm not very coordinated. I'm not very, um, and she was like, no, it's fine. Just come and give it a go. And I think you quickly realise that people aren't that fussed at the gym, like at your gym,
No.
how good you are, how coordinated you are, whether you can sort of pick it up quickly or not. And actually, they're not really looking at what you're doing. They're doing their thing, they're sparring, they're working on their technique, and they'll help you along.
Yeah. The thing is, at the gym, I think that's what you noticed was nobody's there to judge anybody.
No.
Yet everybody who comes says exactly the same thing as you. I was a bit nervous at first because I thought everybody had been looking at me, when in fact I'm the only one who's looking at everybody.
Yeah.
And I'm not going to judge anybody because my job's to teach. So, and so you got over your initial nerves then and got with a mixed class, as you say. And it's quite, there's some big lads in that class.
There is.
Yeah, and can be quite intimidating. But your brother's quite big and he doesn't intimidate you at all. So you've probably prepared you to deal with big lads, like,
Yeah, and one of I think the first couple of mixed classes I came to, there was quite, there was 2 new lads that were quite big. And I ended up in one of the sessions sort of with him kicking me, when we move around partners.
That's right, when you're doing stations, yeah.
And he was being really gentle and he kept saying, sorry, I'm really sorry. And I was like, it's fine. And in the end, I just said to him, look, my brother's the same size as you. He hits me all the time. Yeah. It's fine.
Yeah.
Just get on with it. And I think that made him feel a little bit better.
Yeah. I think a lot of guys are afraid, to go heavy. Obviously, if somebody, the thing is, Midge, whether you're small, it doesn't matter whether you're male or female, the way I see it. If you're small and you've got a bigger person training with you, they're probably going to be stronger than you. That's a fact of life. So it always amazes me when blokes, especially with women, they're like, oh, I better be careful. But if it was a small man, they'd go mad on them. You know what I mean? And I have to pull them up anyway. So it's always about managing to gauge it. And to be honest, I mean, have you ever felt there's been any egos in the class? This is the main thing.
No, not really. Not that I've come across. I mean, obviously, we're back in the gym Monday, weren't we? And I actually really enjoyed training with Edmund.
Yeah.
Because it was different and he pushed me in a different way. Like, normally I train with one of the girls I met at the ladies class who comes to the mixed class with me. But obviously we've been doing that for a couple of years now, so just over 2 years. And so we have a bit of a giggle, and like, if I do end up hitting her in the face, I'm like, oh, sorry.
Doesn't matter.
But yeah, so it was different one day and I really enjoyed it.
I noticed Edmund was pushing you, but Edmund's got a really nice manner.
Yeah.
And he's got for a young guy, he's got a really good way of working with people. So he'll push you within your limits, not his limits, And I think he's quite patient, isn't he?
Yeah, he seemed very patient. Like, I've never worked with Edmund before Monday. But yeah, I was also very glad to be back in the gym.
Yeah, it was good to see people coming back in. I mean, it wasn't a huge class, but then it's a small space, so we can only get so many in. But the second session was just you and who? It was another chap, wasn't it?
Yeah.
Yeah, I can't remember who was it.
Michael.
Who?
Michael.
Oh, Michael Dupree, of course. Yeah, good old Michael. Yeah, and Michael's quite a nice guy and very nervous as well. But you seem to have lost those nerves now.
I think so. I think as I've been getting to know people at the gym, in the mixed classes and stuff, it's like I've always got on a lot better with boys generally anyway. Growing up, sort of my main friendship group was always boys.
Right.
So it's fine. And as you get to know people, it's a nice gym and it's full of quite a lot of, friendly people that aren't too fussed how good you are, how bad you are, what's going on.
Well, that's what I've always wanted to do, is have a place where people can come. Because my experience of gyms, and I've ran gyms for years and years, is when I've watched other people's classes from a distance, or I've been asked to go in to have a look at them to help them out, there's always been that sense of like there's an us and them. You know, it's almost like when new people come in, it's like, who are they? Rather than,
which is what I've kind of found at kickboxing.
Yeah.
And so I was a bit like, not really feeling it.
Yeah. I think the important thing is that when people come, they should feel welcome.
Yeah.
Straight away, you know, and that applies to children as well. Because, you know, the kids are terrified when they first come in, and our job is to make it as relaxed and as much fun as possible. And to be honest, I do the same thing with the adult class. Yeah. It's about having fun. And if people aren't laughing or smiling at the end of it, either at my jokes or my training techniques, then I haven't done my job. So you've been training a couple of years now.
Yeah.
And do you think you'll get to the point where because you were talking about when you were boxing, you were annoyed at, I guess, because they wouldn't let you spar.
Yeah.
Is that what you want to get to, the point where you can spar with the rest of the guys?
Yeah, I think, definitely. I mean, I spoke to Tor sort of in the ladies' class. I think it was last year, and we were just thinking about fitness goals and where things were going. And awesome. I kind of said, well, why don't you train me to do an interclub?
Yeah.
It didn't happen because, like you say, I'm a nurse. I miss a lot of sessions because of shift work and things like that. And I've got 2 kids at home, and, you know, things aren't always as smooth as you'd like them to be in terms of, you know, getting to classes and keeping your fitness up and stuff.
Yeah.
And like you say, and then we sort of had lockdown anyway.
Yeah. I mean, that's made it even more difficult for everybody, I think. And as you probably saw, I don't know whether you saw the people in the first group, but they were knackered.
Well, my brother came to the first class.
Of course he did. Yes, he was there, wasn't he?
Yeah, so I had a chat with him outside, and he said it was a really good session. And he really enjoyed it, but I think they were all a bit shattered.
Well, I had to pull back because they were all pretty experienced people in the first group. So we went at it quite hard, not full on, because I realised that people haven't been training. But of course, quite a lot of them said they had been doing some sort of training, running, weights and things. But of course, you know yourself, training Thai is different to going for a run or anything, really, isn't it? Because your whole body gets a workout. I mean, I know you've only just come back, but when you think back to when you were training regularly with Tor, how did you feel in terms of, did it make you fitter? Did it make you feel more confident? What sort of things did you get out of it?
What, on training with Tor or?
Yeah, training with Tor. And then, because you trained with Tor and then you started coming to my classes. So, and obviously coming to my classes were a bit of a like, oh, what's it going to be like sort of thing. But obviously you found them okay. Did that help build your confidence or?
Yeah, I think so. I think because the ladies' classes were quite small classes as well, and it was the same people every week and tended to train with the same partner every week. You got comfortable and you got used to sort of what you were doing. Whereas when you come into the mixed class, there's a lot of different people, and generally, although you've got your core group of people that go every week to sort of like, you know, your technical sessions, your fighters sessions, you know, to everything. You still do have a mix of people going every week. So you end up sort of training with different people and doing slightly different things and, coming out your comfort zone a little bit more.
Yeah. I mean, you know, talking about going out your comfort zone, I mean, what you do as a job puts you out your comfort zone quite a lot. And I mean, I'd like to talk a little bit about that. Now, I know, you know, having worked with the med school and things like that, that confidentiality is a big thing. And we've got to, obviously we can't name names or anything like that, but we can still talk about, you know, the sort of job you do. So, because like, you know, working in the NHS is quite a tough job anyway. You know, the people you have to work with, as well as the structure and so on. And it's always in a state of change, isn't it? There's always things going on. It's a challenge. And you've got 2 kids as well. So you've got to like juggle family life, your job, which is gifts, obviously, and come into training. So tell us a little bit about, as much as you can, about what it is you're actually doing, how you got into that.
Okay, well, sort of what we'd call a newly qualified nurse. I'm a newly qualified mental health nurse.
Right.
So I qualified at the end of last August.
Right.
And started my job in last September. And I'm currently on an eating disorder ward for child and adolescents.
Right.
So we tend to work with 11 to 18-year-olds.
Is that a secure ward? Is it, what is it?
Well, yeah, because as with a lot of places in the NHS sort of mental health now, it's swipe cards in and out.
Yeah, yeah.
Anyway, for, you know. So I took because where I work, there's 3 wards, and it's sort of what's called a general admission ward, which is, you know, for sort of kids that aren't too risky, in terms of behaviours and things. And then we've got a high dependency ward, which is obviously higher risk, slightly different things. And then the eating disorder ward. And I took the job because it was a rotational post.
Right.
So I'd work across the 3 wards during my preceptorship.
Right. So that would give you variation in different types of patients.
Yeah. And so I was started on the eating disorder ward, which was, I'd got, throughout my training, I hadn't had an eating disorder placement. I hadn't had a child and adolescent mental health placement either. So that was very out of my comfort zone. I think if I'd gone on to the other wards, it would have been a bit more, you know, I know about the different disorders, because the skills are quite transferable from adult to child if it's, you know, psychosis or bipolar or depression. But eating disorders is so specialised. It's very different. But yeah, I'm really enjoying it. It's taken me a while, I think, to settle in and sort of know what I'm doing, which I think is normal for most newly qualifieds across the board, whether you're working in general nursing, adult nursing, or child nursing, or mental health nursing, or learning disability nursing. But yeah, I really enjoy it. It's very structured because of obviously the eating and sort of how many times a day people have to be in the dining room, and then rest times, because, you know, they have to sit and rest to let the food digest. And it is quite challenging because you've got young people that, you know, are very poorly, very ill, me and my Brummie accent, and don't want to eat, and the anorexia doesn't want them to eat, or the eating disorder doesn't want them to eat. So you're challenging that all the time, and challenging that thought process and that illness that's going on.
It's a difficult field to work in, isn't it? Eating disorder. I mean, I have personal experience. I didn't have an eating disorder, but I worked with girls, specifically girls with eating disorders, and quite a lot of them were quite heavily traumatized, which had partly caused the disorder. So do you find that you're having to deal with traumatized young people as well?
I think recently, it's very complex, like you say. So it sort of depends what's going on. We are getting more complex young people that come onto the ward. You know, they've got a variety of backgrounds and different things going on. So lots of tends to be dual diagnoses of autism or ADHD or other neurodevelopmental disorders. And then obviously, like you say, the trauma part, if there's sort of been kids that have had a difficult upbringing or something's happened. So yeah, it's quite complex.
Yeah, I mean, PTSD in itself is just like a standalone, almost like a standalone behavior. But when you mix that with other pathologies, you know, and you know, things like mental illnesses such as, you know, anorexia, bulimia, and ADHD and bipolar, it makes it a very complex thing, doesn't it?
Yeah, it does.
So when people say, yeah, it's a bit of a challenge, when you describe what you do, you think, it's a bit more of a challenge. You would think, you know, a lot of people just wouldn't put themselves in that position at all. Is it what made you go into nursing?
I think I always wanted to be a nurse.
Right.
And at 18, I was like, right, I want to do general nursing, but I wanted to do it in the Navy.
Oh,
Um,
right. Okay.
and I applied and failed the medical on my hearing test.
Oh. Okay.
And then I kind of got a little bit stuck in pub work, which is what I was doing at the time. Had my oldest son, and then after I'd had him, I kind of got into care work, and I worked with adults with autism for 11 and a half years because I stayed throughout my nursing training as well.
So while you were doing your training, you were doing that job as well?
Yeah. I stayed on like the bank on relief, and just did as and when, depending on if I was on placement or what work I've got to do.
Yeah.
And then just sort of family and friends experiences over the years. You know, I've had friends that have had various sort of mental health issues, sort of depression and stuff. And then a family member, I won't name them or say who, because
no, that's understandable.
But they developed paranoid schizophrenia. And I think I was about 18.
Yeah.
And it just really interested me. I was kind of like, well, you know, we grew up together, we'd, you know, spend a lot of time together and stuff. And I remember thinking, well, what happened? Like, what's sort of not triggered it, but what's, you know, has something happened? Why has his brain worked like that? Or why has this sort of, you know, developed? And then, like I say, as I got older, I had other friends. And I think, I don't know, I've always just been the sort of person that wants to support people and wants to, you know, if I can do something for someone, then I will. You know, and I've had friends phone me at silly o'clock in the morning because they're having a panic attack or something's going on, or you know. And I just thought, after I had my youngest son, so he's about 5.5 now, I just thought, if I don't do my nursing now, I'll never do it.
Right. Yeah.
And
that makes sense.
Yeah. So I started at 30 on the nursing degree,
which is quite old, isn't it? I mean,
well,
it's mature student, isn't it? I mean, I went to university when I was 29.
Yeah.
So you're considered a mature student, aren't you?
Yeah. But there's quite a mix. Like, when you go into nursing, I was really worried about, like, being the oldest and, you know, is everyone going to be just out of college? But it wasn't like that at all. There was a really good mix of people, experience and ages, you know, on the course throughout. So
I've met lots of nurses, and you talk to them, and quite a high proportion of them go into nursing quite late, you know, in their 30s, and it's something they've really thought about, and they've just never had the opportunity, I guess, to, you know, because a friend of mine did that when he was like 38 when he decided he was going to become a nurse, you know, and it was totally unexpected. But it was what he wanted to do, you know. It was like, it's not like a job, is it? It's like, for a lot of the nurses and doctors that I've met over the years, it's more of like a calling, isn't it? It's like, you have to do it.
People say it's a vocation. It's, you know what, you've got to really want to do it. You've got to really want to, you know, go in there and support people in times, in their worst times, really. People come into hospital, whether that's, you know, an adult general ward, like, you know, A&E or surgery ward, or whether it's a mental health ward, or that's generally at the, you know, worst point in their lives for them to, you know, be having to access any sort of treatment, really, in that kind of situation. So Yeah, but I also, I want to say, I also trained with some really, really good nurses that I know are really good now, and they were straight out of college at 18.
Right.
And I think, again, it's just about experience and, you know, what you want to do, and if you've got the opportunity to do it, then yeah, I think,
So
you know.
what's your best? Have you got your best success yet? I know you've only been out of training for a short period of time, but there's got to be patients that you've been working with, and they've worked, because at the end of the day, your job as a nurse is to intervene and give as much support and help. But ultimately, it's the patient that has to want to get somewhere with your help. What's your, you know, what I'm trying to say, I guess, is what's one of your best successes that you can think of, if you have one? Obviously, you can't name them, but you must have had one.
I don't know. I think as a qualified nurse and in an area that I've never worked in before, I think I've got to give credit to the team, really, because I'm only really sort of feeling like I'm just about, you know what I'm doing, and I'm settling in. I can go in, I can run a shift, but there's still a lot, especially because it's such a specialised area, that I don't know, sort of like, you know, I'm still asking questions and going, oh, is that right, or is this right? So I don't, you know, I don't think there's been anything just I've done personally. I think it's definitely the whole team at the place that I work at.
I had a feeling, right? I had a feeling you were going to say that. And whenever I've spoken to clinicians, no matter what the level they're at, from the highest, you know, senior consultant surgeons, all the way down to even nursing assistants and that, people have always said the same thing. Well, it's not me, it's the team.
Yeah.
You know? And does it feel like it's a team?
Yeah, definitely. I think where I work, people are really quite supportive. The trust I work for, it's the longest preceptorship. It's an 18-month preceptorship. So preceptorship, when you're a newly qualified nurse, you're kind of still looked after a little bit. Like, they still check in, make sure you know what you're doing. Some trusts, because I trained in a different trust to the trust I work in now. You know, some preceptorships are 6 months.
Oh, okay.
And that's it. So an 18-month preceptorship, to have that guidance and have that, you know, to keep up with your training and all that sort of things, and to make sure you're accessing your supervisions, and just to have that little safety net is really good.
Well, that's good. I mean, that's good that people who've not worked in hospitals or the medical profession, it's good for them to hear the fact that this goes on anywhere.
Yeah.
I mean, even in GP surgeries, they have significant event meetings. They support each other, and I think it's important that people know that, because the NHS gets a bad rap some of the time, mainly from the press, who are just after a story. When in fact, if you look at actually what they do, and you've just said it yourself, you do it because it's a vocation, it's a call, and it's a job because you want to help people, and getting that message across is really important. But that actually you're working with a whole team who have the same attitude as well, and on top of that, they've got to take time out, particularly the senior nurses and clinicians, to give you support and help and ongoing training, I guess. Yeah. I mean, a lot in a lot of jobs, once you've got the job, that's it. You know, you very rarely get that. And I mean, do they still? And I'm thinking back a long time now to. I was originally married to a psychiatric nurse, as she was then, many, many years ago. And they used to have supervision sessions. Do you still have things like they still do that?
Yeah. So we have, everyone's allocated a supervisor, and you have the 6 weekly supervisions, but we also have group supervision once a week. It's called staff support. So, and you're in there with the consultant that's, you know, over the ward, usually your ward manager, and then whoever's on shift, and you can sort of talk about what's going on the ward, the sort of morale or difficult, well, not difficult, but patients that you might be struggling with. and everyone can sort of bounce ideas around and say what they're concerned about, sort of talk things out in a group supervision as well.
Well, yeah, I mean, because I know in medical nursing, for example, the nurses who have to have some form of supervision, and because obviously sometimes you might lose a patient, for example, and that's quite a big thing to deal with. And a lot of people in civvy street, as it were, who've never been in that position before, would struggle to deal with it. And people don't think of that aspect of nursing because not always everything turns out the way you want it to.
No.
And particularly in something like eating disorders. And I mean, you use the word, these young people are ill, and you don't just mean mentally ill, they get physical symptoms because of eating disorders.
Yeah, within eating disorders, there's a lot of obviously physical illness from the body being malnourished or dehydrated.
Yeah.
Generally, if the young people are very, very poorly, they'll go to a general children's hospital and get those levels back up, or get their physical health sort of stable.
Yeah.
Before they then come over to us.
Because it's like trying to get across to people as well, because I've tried this, and it's good to talk to somebody who's actually on the job. When people have an eating disorder, they don't just lose weight and get a bit skinny. It damages the internal organs as well. The body sort of feeds off itself, doesn't it, to a certain extent. So I mean, eating disorders is quite a funny one, because it's considered a mental health issue, but it's also a general health issue as well. It's not just straightforward. I mean, I don't think any illness is straightforward.
No.
Something like schizophrenia, for example, doesn't have a lot of clinical problems, like you're not going to damage your heart, your lungs, your kidneys and so on. But with an eating disorder, it's like two-pronged, isn't it? You've got two things going on.
But I'm
guessing,
I think with any mental health issue, sort of then you've got to look at, so for example, schizophrenia, some of the antipsychotic drugs that help people with whether it's voices or hallucinations, can then cause heart conditions or an increased appetite and things like that. So I think fitness and health and nutrition is really it's really important, and education on it, not just about losing weight. Like a lot of sort of, you get the industry of lose weight, and that will help, but actually understanding what your body needs to be fit and healthy, so the proper nutrition, the proper hydration, the exercise. And also exercise will help you feel better because it releases those endorphins, which will eventually help your mental health. When I was training, I did a placement in early intervention in psychosis, and they had a specific gym and fitness program for people with psychosis or schizophrenia, and they were sessions with other service users, and they had access to several gyms within the area,
right,
and specific times with a the specific trainer that was trained in mental health and physical fitness. And they had, so the first hour of the session was sort of like around education, around nutrition and the benefits of exercise and the benefits of healthy eating and healthy lifestyle, and then the second session would be in the gym using the equipment, teaching people how to use the equipment and helping them do that. And that was something I was really quite interested in as well. It was really good.
There's a lot of different threads, isn't there, strands to the job you do.
Yeah.
When people think of nursing, they think, well, I don't know what they think, but they just think it's just one job. But in fact, you've got to put lots of different hats on in the day, haven't you?
Yeah.
And you've got to know a lot about a whole range of subjects, not just specifically eating disorders, for example.
No.
So you have to know about drugs as well, of course.
Yeah, and I think with any mental health condition, you have people coming onto the wards, whether that's adult, child, or wherever, and they're going to have physical health issues, whether that's diabetes or high blood pressure, or you know, or associated things like, say, like autism and ADHD. And yeah, you kind of have to navigate it all, really.
Navigate's a good word, yeah. Yeah, because it can be a bit confusing, I guess, when you've got so many different things going on. And then, of course, you got, on top of all of that stuff, you got the responsibility of looking after another human being as well.
Yeah.
Yeah. Which you enjoy doing.
Yeah. Yeah. I do.
Yeah. I mean, there must be some days when you must be exhausted after a day.
Yeah. Yeah, there are. And
you
there's
always
been
want to go
days,
back, though.
yeah, I'm still going back. So like, you know, with the Zoom sessions, there's been days that I've got home from work because you've been running online Zoom
Oh,
classes.
yeah, the online
through
training
lockdown.
sessions. Yeah.
And I've sat on the settee and I've just thought, I can't even get up and go in my own gym because I've got a gym in the garage. I can't even get up and go in the garage and do Thai.
Yeah. Because, I mean, the thing is, the job you've got, it's not just physically draining, is it?
No.
You know, because of the nature of the job, it's going to, some days are going to be much harder than others, you know, mentally. And I don't mean that in a bad way, that could be in a good way as well. You've done a great job all day, but you put like 110% in every patient. And it's like, that's it. I've had enough now.
Yeah. And again, that's part of the reason that I do Thai as well, because although there's some days, like I said, especially through lockdown, that I haven't, once I'm sat on the sofa, I'm done. But it actually, it makes me feel better and it improves my mood. And, you know, like Monday, I'd been grumpy all day, I think. I'd been a bit like, you know, just in general. But then I came to Thai, and by the time I got home, I felt, you know, just so much better, and I was in such a better mood.
Yeah. Oh, I mean, it's exactly what you said, isn't it? I mean, you said yourself, with patients, you start the endorphins buzzing around, and it makes you feel good, and you know, you start to feel a bit more positive about yourself and your abilities, you know. And if you're ill, it helps you get well, you know, a lot quicker, mixed with a good diet and nutrition, obviously. And it's a bit like Thai, really, in a way. Although I'm not a nurse, you know, when I've got fighters, I've got to think of them holistically. It's not just physical training. There's the mental side to it, and of course there's the nutritional side to it as well.
Yeah,
you know, make sure people eat properly. And you've probably heard me online saying, make sure you get a drink.
Yeah.
You know, because men are the worst ones for that. Not drinking. And you see that with older geriatric patients. It's often old men are confused simply because they haven't had enough fluid.
Yeah, because of the dehydration.
Yeah. And when you're coming back to these kids, you know, with the eating disorders. Now, when people think of eating disorders, they think of anorexia nervosa and bulimia. But there's the other side of the coin. Do you work with obesity as well, or is that a separate thing?
No, obviously obesity is classed as an eating disorder. But no, so generally we haven't had anyone on the ward that, you know, has the opposite sort of, because like you say, it can be just as dangerous.
Oh yeah,
strain on the heart and the body. But no, it is generally anorexia, bulimia, and then we've had diabulimia as well.
What's that?
So diabulimia is if someone is diabetic and they can develop obviously an eating disorder, but they restrict their insulin to lose weight
deliberately.
So, yeah, deliberately.
Pretty dangerous.
Yeah.
Wow. Yeah, I've never heard of that. That's a new one on me.
Yeah. So obviously, most people with diabetes have got a good, you know, concept of their carbs and how much insulin they need, depending on how many carbs they've eaten, and you know, to be fit and healthy, to keep things ticking over. But if you're not having enough insulin, then your body will drop the weight.
Yeah.
Because your body's not processing the carbs.
Yeah.
So.
Yeah, that's not a good thing, is it? That's a sure way to kill yourself, isn't it? I've never even heard of that. I've learned something. Wow.
There you go.
Diabulimia. And I guess there's got to be lots of other sort of eating disorders going on that you come across, but I guess the main ones are going to be anorexia nervosa, bulimia, and of course there's diabulimia as well.
Yeah, which is still quite diabulimia is quite a, I want to say, newish diagnosis.
Right.
So we touched on it at uni sort of briefly, and then had just, I've come across one young person with it.
Yeah. Where did you go to study, by the way? I never asked. Which you?
I trained at Worcester.
In Worcester? Oh, okay.
Yeah.
Oh, I know a few people at Worcester.
Yeah.
I'm not going to name any names, but yeah, people who do training for nurses and
okay. It's a really good uni, and I absolutely loved it.
And Worcester Hospital is really good.
Yeah.
So did you get any sort of placements at Worcester Hospital as well?
Well, no, because I'm mental health trained, so all my
general medicine,
my mental health placements were, apart from my had a health visiting placement in first year, which is kind of what swung me to be working with young people, because my mentor was, you kind of go in and you think, I know what health visitors do. I've had 2 kids. But actually, the mentor that I had, she related everything to mental health. So she, the parents' mental health to the child's mental health, and we looked at attachment issues and a lot of safeguarding, and child in need meetings and things like that, and looked after children and how being a looked after child affected their mental health, or whether staying in maybe a domestic violence household affected their mental health and what the outcomes were. And like I say, like parents as well with mental health issues, because the health visitors are then dealing with that, not just with the child under 5. They're dealing with it all. So
yeah, we know, a lot of people don't have sort of lives as confusing and as destructive as that, and it's good that talking to somebody like you, certainly other people listening who're not even aware of this sort of thing going on, it hopefully give them some sort of insight into how serious their problems really are.
Well, it's all relative, isn't it? It's all.
I knew you'd say that because you're a nurse. No, but it's true. It is all relative. But it sort of puts it in perspective. Sometimes, you hear people whinging about the weather and things like that, and they make a big deal of it. And you think, well, yeah, but, in the scheme of things, there's, a lot. It could be a lot worse,
Yeah.
I know. You're a nurse, so you.
It's about your individual situation, isn't it? Do you know what I mean?
Yeah. It's how you cope with things, isn't it?
Yeah.
Everybody's different. Yeah. So, so mental health nursing and Thai boxing, the two seem to work really well, don't they? I mean, do you think Thai boxing classes for young people in a hospital situation would work? Because the reason I'm asking this is because I did a lot of work with youth offending teams. Now, these were kids with mental health problems, but mostly around anger.
Yeah.
Usually out of abuse. And the serious cases would end up being hospitalized, obviously. But we found that I was doing a lot of intervention work, not just with Thai boxing, a lot of NLP and other related things. But quite a few of the kids responded really well to Thai boxing sessions. I mean, are the kids encouraged to do anything like that, like training on?
Yeah, obviously not on the ward I'm on.
No.
Because obviously there's the issue with over-exercising, with eating disorders to burn calories and things like that. Obviously, as they're at a later stage in their recovery and getting ready for discharge, we do look at, healthy exercise, and they'll go to the gym with the OTs and look at, what's moderate exercise, what's good to stay fit and healthy, and being able to manage that type of exercise. But one of the staff from the other wards, when I said I did Muay Thai. She was like, "Oh, could you teach it to the kids?" And I was like, "No, not quite there." But I did ask Tor, and gave the details over. But the problem was insurance-wise, because it was somebody, coming in to a hospital. So I don't think that really got off the ground. But I do think for, the kids that have either got depression or, are struggling with self-confidence issues or, like I say, even psychosis or whichever, whatever's going on for them, I think it'd be really good for them.
Yeah, I mean, it worked really well with the young kids down in Swansea, where I used to work down there, and we got really good results. Actually, better than counselling in some cases. All the kids needed was a bit of bag work, bit of pad work. Felt that they were capable of achieving something because they didn't feel they had ever achieved anything because that's what they'd been told.
Yeah.
And it really spurred them on and improved, obviously, physical health always improves mental health and vice versa. Good mental health means you'll go out and train, and the two work hand in hand.
Yeah, absolutely.
So what's next for you with the Thai boxing and with your job? And what, anything else we haven't talked about you'd like to mention?
I don't know. I think at the moment, in terms of my job, I'm just coming up to a year qualified, so I've still got quite a lot to learn, quite a lot of experience to gain. Like I said, I want to rotate across the other wards as well, eventually, to get that experience of different things. I think eventually, sort of later on, some years down the line in my career, I'd like to end up either maybe as a custody nurse, or in the triage cars, because in Birmingham, if there's a mental health issue, the police go out in the triage car and they have a mental health nurse, a police officer trained in mental health, and I think a mental health support worker.
So is that the same as, because they used to have CPNs? Is that a similar thing?
No, so your community psychiatric nurse is just that. So she will have, or they will have, their own caseload.
Okay. So they
going
just
out to people's houses. Yeah. So this is more of an emergency situation. So a call would come into 999, and they might say, look, we think this person's got a mental health issue, or it's mental health related, and the triage car will go out instead of just your general police response.
I think I've seen something like that on one of these TV programs. They had a psychiatric caseworker sort of going out with the police, I think it was somebody suicidal or something like that. So that's what you'd like to be able to do.
I think so. I mean, when I first started my nurse, say again.
Sounds good fun.
Yeah. I think when I first started my nurse training, I was very much like I was going to be a forensic nurse. I wanted to go into the criminology side with adults. And then throughout my training, I was like, I really, really enjoyed my health visiting placement. And I really, really enjoyed my older adult functional placement. So older adults, again, with not dementia, but things such as schizophrenia, psychosis, bipolar. And I think that's because of the mix between the physical health stuff and the mental health stuff.
Right. So that's what you want to do in the future, working with a triage team, hopefully. Might see you on a TV program one day. What about the Thai boxing? What's your goal? Come on, what's your goal for that? And I'm going to hold you to this because I can't do anything about what you decide to do at work, but in the gym I can.
I think just to get fitter and stronger, and maybe eventually do an interclub, and a bit of residence. Thing is, Bob, I'm not a giver-upper. So for example, lots of people know this anyway, but it took me 4 times to pass my GCSE maths.
Right.
It took me 2 attempts to get onto the nursing degree. It took me 5 times to pass my driving test. And I just think if you want something and you want to get good at it, you've just got to keep going, because I know. Yeah, I think a lot of people, especially with things like driving, they're like, "Oh no, I failed my test like 2-3 times," and then I'm there like, "Well, that was a waste of time and effort." Like, I put all that money into it and been doing my driving lessons. I was like, I am not giving up until I pass.
I know somebody who failed 9 times.
Wow.
and then finally passed.
Yeah, and I think you've just got to, keep going. So I knew I really wanted to be a nurse. So I was pregnant with my youngest son. I was working full time at the autism home.
Yeah.
I was going to Bourneville College once a week to do my GCSE maths of a night time, and I was doing an open uni degree to get enough UCAS points to get into uni.
Wow. Yeah. You see, and it's funny because I listen to young students that I work with who've got loads of time. They're single. All they've got to do is focus on their degree.
Yeah.
And I'm thinking of a specific place here, which I can't mention, but so you've got about 4 or 5 of these very young people who, it's a post-grad course, the course that they're on. And there's a chap on there who gets all the highest marks. English is his second language. He qualified as a doctor in China, but the qualification doesn't stand here.
Yeah.
So he came to the UK, and as well as having 4 children, and his wife, who works and looks after the kids, he goes out from the university after the course is finished, taxiing every night of the week till 2 o'clock in the morning, because he can't afford to do everything. And he gets the highest marks. And I said, I always use him as an example. I said, if you really want something, you'll do it. And he never complains. If he gets a bad mark, he doesn't blame anybody else. He just thinks, right, I've got to work a bit harder on that. And it's interesting because I tend to see that with mature students. They're there because they want to be.
Yeah, absolutely.
They haven't just gone to school, got their A-levels, gone to uni. I mean, I'm not saying all students are like that or bad, and some of them do work very, very hard. But quite a high proportion of them, it's literally school, college, uni, without any conception of what it's like to actually work for a living. So I think when you go into uni, particularly like you've said, you 2 attempts to get into the uni, but you weren't going to give up. So basically, you want to be a British ladies champion this time next year.
I don't know about that. I think I might be a bit old for that.
Yeah. Well, I didn't want to say that, but if you're over 30, Thai boxing's a waste of time for a comp. But having said that, I have known 1 or 2 exceptions. It's been pretty rare. But obviously, having an interclub, you see, the way I see it, anybody who comes in regularly training, particularly when they've got a job and family and stuff like that, especially somebody who's older, more mature, I always take my hat off to them when they climb in the ring for the first time. And it's not about winning or losing, because it sounds like a cliche, but anybody who gets in the ring's already won. You know what I mean? Because it's a huge deal, I think, particularly in Thai boxing, interclubs. So long-term goals then, triage.
Although I might change my mind.
You might change your mind, of course, because something else might pop up and you'll go, ooh, I'll have that. And having a go at getting fitter, getting stronger, getting better at Thai boxing, and not giving up, and hopefully getting an interclub under your belt.
Yeah,
I'm not going to hold you to that. I'm just saying.
You are.
Well, okay. Well, look, we've done an hour, believe it or not.
Oh, wow.
It's flown by. And you said, I don't know what I'm going to talk about, Bob. So I'm going to say thanks very much. And I will see you, hopefully, on the Monday night. Am I right?
Yes, I've now got Monday off. So I will be in on Monday.
So that's a promise then.
Absolutely.
It's been brilliant. Honestly, it's been really interesting. And I think other people are going to find this just as interesting. Thanks so much.
That's okay.
Yeah, I'll see you later.